Dr. Julius Hyatt, one of the co-creators for Maxillosoft. I want to give you a quick overview of the EMR portion of our program. This is the dashboard, and it gives you green so you know that the assistant has the patient has been seated in the room and they're ready to be seen. That's what green represents. Yellow would represent they're not quite ready yet. And also it shows me where I'm going and who's in what room and why they're here. For instance, third consult versus implant. This person's appointment time was 9 a.m., but they've been waiting for 18 hours. That's a bit long. This person, 10 a.m., they've only waiting 5 minutes. So, you know, this is a demo program, so that's why that's like that. But if we just go into the third consult for this Antonio Nelson, now the assistant is pre-populated most of this pre-page in here, which why the patient's here, are they having symptoms, who sent them here, if they had any prior treatment, so all that's been negative. The rest of the face sheet is basically your previous medical history, previous surgical history, medications, allergies, social history, occupational history, family history. All that stuff's available. Now, the important thing about what we have for this EMR is you can include what you want or what you don't want in here. You can have as little or as much information included in your record as possible. You can choose to use all the information or all the templated spots available, or choose to use none. That's really up to you. So you can choose to use whatever you want. And that's just the general history. Obviously your physical history is going to come in now. your assistant's going to acquire the vital signs, initial vital signs that are in there. And then you have, we have a shortcut section, which I'm going to go into in a bit. And this is your whole physical exam. So again, you can be as complete or as do as limited exam as possible, or you can be as complete as possible, because everything's here from your head, neck, HEENT exam, oral cavity, whatever's going on in the oral cavity between the buccal mucosa, labial mucosa, lips, hard palate, soft palate, tongue, floor, mouth. Everything is there. Radiographically, you can describe what's on there, and even a neurological exam is all included as part of that physical examination. It's pretty complete. Now we're going to talk about some of our shortcuts, which makes things a lot easier. So for instance, let's say if somebody come in, it's a healthy young person, 24, and they got complete bony impactions, you just want to record this as quickly as possible, and there's very little to change. We have a shortcut version for wisdom teeth, and you'll ask you, okay, and it fills in and pre-populates virtually everything there that you possibly have. We can go back to the physical exam, and you'll see that we do have a shortcut for just a normal exam, which is all here. Things are pre-populated. That's all filled in. This wisdom teeth, all 4 of them were selected. And then you go to your assessment, and it's already located the teeth. It's described the teeth. They're all complete bony impactions. So here's all the teeth. And if you go to your summary on this part, and it chooses already, because you're going to, it's 4 complete bony impactions. The majority of people want to go to sleep, so it's already pre-populated. They're ASA1. We're going to give them general anesthesia. We're going to use 2 units. And we've discussed the certain risks, and we get time to schedule the appointment. One of the important things is this treatment estimate that you'll see. It shows up at the corner there, and it just shows me exactly what's going on, and it's eliminated a lot of errors and omissions. So here's the treatment estimate. It's here, and formerly used to have a scribe that would write things, and things would get omitted or lost or forgotten. And so this is a lot more accurate. There's no need for anybody to use a calculator and add and subtract, because people can't seem to use calculators correctly either. And so these are very accurate, and the patient knows exactly what their responsibility are, and there's fewer errors and problems with that. We've got our treatment estimate. We can minimize that, and let's preview our report. So here's our consultation report, and it shows basically in the detail that we included all the things that have to do, that was your treatment plan. And this was, obviously you don't have to worry about reading it. It's not written, it's legible, and this is much, much better than anything I ever previously was able to produce. So that is a super quick, super easy method using shortcuts to record a wisdom tooth consultation. It takes literally about 20 seconds to record that, and you get a good report from that. But you can still do it any other way you want to do it with whatever detail or limited detail you want to have. You can use the shortcuts or choose not to use the shortcuts. Not only that, you can create some of your own shortcuts. So that's how flexible and easy this program is to use. This program really is beneficial on so many different levels in terms of patient communication, your record, recording, electronic medical record, and it's going to really help everybody in our profession who does oral surgery, and I strongly recommend looking at this and considering this for your practice.